right in the middle of cold and flu season. While colds are relatively mild infections, they can make kids feel miserable and their parents often feel helpless. With advice on how we can help our little ones survive the common cold, and parents as well, is our Dr. Mallika Marshall. Doctor, nice to see you.
Good to see you too, Liam.
One of the first things you say is just stay away from the cough and cold aisle at the drugstore.
That's right. Just pass it on by. And that's because those cough and cold preparations are generally not recommended for kids under 6. They can be dangerous. They don't really help that well. They don't even really help that well for older kids. Now, instead, go for the pain relievers and fever reducers. Plain things like acetaminophen found in Tylenol, ibuprofen found in Motrin or Advil. These can take care of low-grade temps, and they can also help with like a sore throat or a headache or an earache that a child with a cold may have.
But stay away from the antihistamines unless your doctor says you should do that.
That's right. Sometimes kids have a really bad cough that keeps them up at night, keeps their parents up at night. So sometimes a pediatrician will recommend an over-the-counter antihistamine to sort of help them sleep. Talk to your doctor first, though.
That's medicine. What about non-medicinal help for kids?
Okay, so don't forget about saline nasal drops. This is just salt water, which can actually help with nasal congestion. If you have an infant, you can use it in combination with a bulb suction, so you can get all those little boogies out. Also, a cool mist humidifier in your child's room while they're sleeping can really help with nasal congestion as well as cough. You, of course, want to get your kids to drink lots of fluids. They may not be that hungry, but they have to stay hydrated. You can try herbal teas with honey, although never give honey to kids under the age of 1. And then you can try cough drops, which can be soothing for coughs and for sore throats, as long as your child is not at the age where they're at risk of choking.
Older kid, yeah, you don't want them to choke.
Right.
What are some ways that we can prevent the colds in kids? Is there anything that we can do?
So unfortunately, there are a lot of things marketed out there that might be vitamins or herbal supplements that parents reach for, but there's really no evidence to suggest that they're going to help your child once they have a cold. So forget the vitamin C and the echinacea and the zinc. Instead, focus on the things that we know work, and that is to encourage your kids to wash their hands frequently, use hand sanitizers, stay away from people who are already sick, and then obviously try to make sure they get regular sleep and they get well-balanced meals, because all of that will help build their immunity.
And then, of course, it's just a waiting game oftentimes. You're just waiting for it to run its course.
Exactly. So most kids get better within a few days, sometimes a week. Sometimes that cold might last for a couple of weeks, but as long as your child is otherwise well, they're in good spirits, they're not short of breath, they don't have recurrent vomiting, it's probably just a cold and it will eventually go away.
And if any of those latter things are happening, that's when you should probably get your kid checked out.
Absolutely. Call the doctor.
Well, Dr. Mallika Marshall, thank you so much.
You're welcome.
It's nice to see you.
You too.
Much more here on CBSBoston.com.